I want to talk to you about a common problem we see in especially male patients. It's called gynecomastia, enlargement of the breast tissue in males. There's a lot of different reasons why this can happen. Sometimes it's just related to hormones changing during puberty. So that's one thing. Sometimes certain medications, like if we're older, we're taking certain medications, they can affect metabolism of certain hormones. And then those hormones are in our body more, and it stimulates growth of the breast tissue, and also be related to certain tumors. So it's important that, when we have a patient that has this, that we, do a full, thorough examination and history. There are different ways of treating it. Here's a typical example of one. This was a young man, I think he was 19 or 20. He was in the military, and I'm sure he was ridiculed and so on for having the enlarged breasts over here. A lot of times it's more fatty tissue, and you can just treat it with aggressive liposuction through a couple small incisions, and that's what I did in this case. A couple tiny incisions maybe near the areola here, or out to the side of the chest wall. You can get in there and you can remove a lot of the extra fatty tissue that's associated with this sometimes. And that's pretty much all we did here. Occasionally we have to use some energy devices like Vaser that does help emulsify and break up that tissue a little bit better. And then at times, even with liposuction, there's still tissue that's left over. You could feel it under the skin. There's some firmness there. That's not going to come out with liposuction. A lot of times we have to go through, and now what I do a lot is just using one of those small little liposuction incisions, go through there, grab that firmer tissue and use small scissors and kind of just snip it out until it feels like it's all been removed. And so that might be a slightly additional step during a gynecomastia procedure. These type of procedures sometimes can be done under a local anesthesia, right in the office. As long as it feels very soft, there's not a lot of excess tissue there, you could just do a simple liposuction case right in the office, local anesthesia with a little oral sedation. Sometimes if there's more aggressive gynecomastia, larger breasts, firmer tissue, that's going to need more surgical kind of excision, and so that will sometimes be done right in the operating room under regular anesthesia, so we could be a little more aggressive and make sure we get all that tissue out and give the breasts a nice contour. This is the other view, this angled view. You can really see how much that extra breast tissue is just being pushed out. And here it's looking more like a normal male chest wall.